Then we will start our work. Today I will speak about the V-line, the biostimulation. Then everybody knows what's happened during the aging. Basically, we lose our volume. We lose the volume in the deep and superficial fat. We lose the volume in our muscle, and we lose the volume in our bone. And then we change our characteristic of the skin because, of course, the photochronoaging, and after we produce less collagen. What's happened? Normally, we make few sessions of treatment before we treat the deep part with the filler to make a contour, to make our facelifting, to make our beautification. And after that, we start to treat the skin quality. Today, we propose our solution to treat everything in just one day in two different steps. What's happened? Before, we will treat our deep layer of the face, making up the contouring and our lifting, restoring the volume. And after, with the Infini V line, we will treat the skin to make, of course, better our skin, stimulate the production of the collagen. Then, this is the first product. It's the V5. It's a product that is done with two different weight of hyaluronic acid. Less weight, 300 kilodalton, and medium with 12,000, 50,000 kilodalton. And it's mixed with such amazing substance. It's trehalose, which is a trehalose. It's a sugar, and it's consisting of two glucose molecules linked together. The mechanism of the action of the trehalose, it's interesting because we can see the trehalose in the plant, in yeast, and in insect, and it's so important to protect these things to the anhydrobiosis, because the trehalose work to survive an extreme dehydration. In cell, trehalose can replace water molecules around the macromolecule, forming a glass-like matrix that preserve the structural integrity of cells and proteins when water is scarce. Then it's important to know that trehalose doesn't react with amino acid, protein, and lipid. Then it's so important for the lipid membrane, to stabilize protein and lipid membrane against denaturation in a different way, like drying, freezing, or heating. Then we can see the function of the trehalose: osmotic regulation, chemical stability, thermal stability, which is the kind of hyaluronic acid inside of V5. We have a fermented hyaluronic acid, and basically every ferment of this kind of hyaluronic acid is targeted to specific receptor in the skin, the CD44 receptor. These receptors are on top of the fibroblast, and then when we stimulate the CD44 receptor, we stimulate the fibroblast to produce new collagen. And what's happened in the V5? Basically, the hyaluronic acid stimulate the fibroblast to produce collagen, and the trehalose protect the hyaluronic acid. And then what we have the long-lasting hydration of the skin. Basically, 2 ml in the syringe with 50 milligram of hyaluronic acid and 20 milligram of trehalose. I'll explain it, the kind of hyaluronic acid, low molecular weight and high molecular weight of hyaluronic acid. Then high purity of the product, and we have highest level of hydration and long-lasting hydration. This is our old effect, long-lasting effect, stimulation of collagen production, reduction of oxidative stress, and minimizing of the side effect for the purity of the product, which is the way to apply the product. This is our protocol application. Basically, it's possible to treat the zygomatic, protrusion, trago, nasal base, mandibular angle, and chin. It's possible to use with the needle, but I prefer to use with cannula, 25 gauge cannula, and we have to inject the product on the deep derma or in the immediately subcutaneous. The results are lifting effect, moisturizing, induction of production of collagen type 3, biostimulation effect, and skin tightening. Treatment session, 2 or 3 treatment sessions, 4 weeks apart. This is the point. And the second product that we speak today, it's a V20 face booster. V20 is done with the highest quality of hyaluronic acid with high concentration, 4 milligram in 2 ml, with medium weight, 12-15 kilodalton. And in this case too, all the fragments of the hyaluronic acid are targeted to stimulate CD44 receptor. Then what we have the stimulation of fibroblasts, and the consequence we will have a production of collagen type 3. This is the way that we can use. We can inject with the 6-point injection with 0.2 ml for each point and 1 point for 0.1 in the chin, or we can use a cannula in the same way in the deep derma or in the superficial subcutaneous. The last product that we will speak today is the polylactic acid. Everyone knows the effect of the polylactic acid. Basically, he will make a soft controlled inflammation, and after that, he promotes the production of new collagen type 1 and type 3. In this case, we have 150 milligram of polylactic acid, 90 milligram or sodium carboxymethylcellulose, and 125 milligram of mannitol. What we can do, we can stimulate our skin, we can correct wrinkles, folds, scars, and fat tissue atrophy, improving the quality of the skin. Basically, in which way we can use it? Normally with the cannula in the same position. We have to stay or in the deep derma, not so superficial. It's important, don't use the polylactic acid too superficial, or in the immediately subcutaneous. We can prepare the product not 24 or 44 hours before, but just need 2-3 hours. We prepare it before to use it now. Normally, I prepare it 3 hours before with 8 ml of normal saline solution and 2 ml of lidocaine. But I use it without lidocaine too, to try, not to make something worse for my patient, and it's not painful. After, we will show the way to prepare everything, and we will treat the patient with the polylactic acid too. Okay? Thank you so much. We finish. Question? Hi. In the transplanted skin, I don't have any experience about it.
So you won't?
I don't have an experience about the transplanted skin. I use it to treat the scars in a normal accident or a normal scars.
Okay.
And I use a hyaluronic acid sometimes to treat it, and it's really good. But I don't have any experience about the skin transplant.
Squamous cancer. Okay. Thank you.
Thank you. Any question? Hello.
The injections, when you use cannula, is linear or you release bolus of product?
Normal, I use linear. I use linear with the fan technique, and I try to don't inject too much product to run every line, and I make fast massage. And it's so important after the treatment that the patient have to know the rules of 5. 5 minutes, 5 times a day for 5 days, they have to make a massage in their face. This is really important with every polylactic acid.
No, thank you.
Yeah,
It's important, but excuse me, but I don't. Thank you. For the V5,
yes.
the same. If you use a cannula,
Yeah.
linear.
Yes.
Okay, thank you.
Yes. For the V5, it's possible to make bolus too, and after you can push it a little bit. Nothing happens.
Hi, my name is Lucas Prebis. I'm from Warsaw, Poland. I have 2 questions to you. The first question is about the collagen production that you were mentioning here. I'm not quite sure on which collagen you were focusing, because you said collagen 1 and collagen 3. I would like this to be cleared for us.
Normally, it's collagen 3.
That's good. That's good. And the second question
but
is...
But there are studies when you use it polylactic acid, then the production is from collagen 1 and collagen 3. We are focused on collagen 3, but I think that with this polylactic acid 2 should be possible that we will produce collagen 1 too.
And the next question is about the V5 product, which looks very interesting because of two molecules on different and different weight. What I was doing in my practice, I was also treating patients after radiotherapy, and this mixture of two weight of collagen seemed to be very useful. Do you have any practice with patients after radiotherapy?
No.
Okay, thank you.
Thank you. No, I don't use... I try to, because polylactic acid is safe, but I will try to make more safe using in the better area. I use in the cheekbones, in the chin, in the jawline, but I never use it under eye because it's like so dangerous area, so sensitive area, then I don't want to take a risk. Okay. Great. Come here, come here, come here. And the technical objection, we will explain today after. 30 minutes. About what? She told me that I have to talk 30 minutes. I don't know about. Any question? No? No. There is no question. Yes, I don't want to talk about.
It's working now? I have one question, sorry to be on the stage, because I think we could be quite interested in using of the V product together with the fillers. And as you know both of them quite good, I would like you to share with us your experience on usage of those two products together simultaneously, if possible.
Yes, it's possible. It's possible. Basically, our idea is, of course, and this is what's happened during our treatment. We use the treatment with the IG prime cross-linked filler to treat the deep layer of our face. Then we work with the filler on bone. We work doesn't work. I'm a tenor. I can speak with a high voice. And then we will use the filler, the cross filler for the deep area because we want to restart the volume or we want to change some volume to make full face beautification. After that, we can use this kind of hyaluronic acid non-cross-linked to just to stimulate the skin. This is what this is the, of course it's our idea. It's some idea that is it's it and the same session. Yes, we use different layer in the same session. Okay. Sorry. Radio frequency. It's amazing. It's amazing. Sometimes we use the PLLA to for the radio frequency. This is it's amazing. We make one session of PLLA after 30 days, sometimes 40 days, one session of radio frequency, and after we repeat. And there are studies that told that every time you make PLA, radio frequency, the skin loses 10 years.
Have you ever mixed like B5 with B2? Have you treated that patient with B5 before and after that with B2?
No. No.
Because it's very good results.
I will try. Okay. Then we are here.
Okay, so now we will have a short coffee break, and after coffee break, yes, now we will have 10 minutes break, and after the break, we'll have another questions and answers with the doctor. Thank you.
Yes, perfect. Now we will make the biostimulation, total face biostimulation. And we will treat the face with the V20 and with the V5. For the V20, just hyaluronic acid. We will make the temporal area, and with the V5, hyaluronic acid plus trehalose, we treat cheekbones with the fan technique. We treat preauricular area from here, and then we treat the chin. We treat all the chin, and we treat the jawline. Just few injection. We use the cannula, I think 60 millimeter or 50 millimeter, 25 gauge. Now we start our treatment. Yeah? Do you want my neck too? Okay. And after we will treat the neck too. Amazing. Are you excited? Okay. Then I will make my entry point. I'm so superficial. Is it painful? Is it painful? And after we make a soft massage. Now we will treat the right side. And superficial. Is it painful? And I will inject some product with the fan technique. I make some aspiration with the cannula too because it's possible to go inside of the vein and the artery with the cannula too. Okay. For this we use it V20, Now we will use for the full face biostimulation V5, which is with two different kind of hyaluronic acid and trialose. Then I don't want to improve so much her cheekbones because it's already good. Then we stay a little bit under. We make our point. We cover here. And we go inside. I'm superficial. Okay? Now, from this side, I will treat, preauricular area. I love to treat this area with the normal filler to improve the volume, because it's crazy good to make fluid lifting. Okay. We will treat a little bit of the joint. Superficial. Are you okay? Any pain? Just a little bit. Okay. Yeah. I know this is a little bit more painful. Okay. Okay. Try to relax yourself. I know this is the worst area. Okay. Now I will put a little bit near your chin too. Okay. We finished one side. Yes, I will open another one. Sorry. After the treatment, We have to make soft massage. Done. No bruises. Great. I will inject the left side. Then it's painful. Okay. And basically we make the same in the left side. We don't want to inject on top of the cheekbones. We stay a little bit down. We have to look the skin because it's of course full of vessel, and we try to don't put our needle into the vessel. Then no, okay, sorry. Same here. It's possible to see here all the vessel. We try to go inside from here. Okay. Are you okay, my dear? Fine? Superficial. Now you will have a new face for the lunch. Done. Okay. Now, do you feel swallowed? Swallowed? Do you feel swallowed? No. Then after the treatment, it's really important, the massage. Now, with the biostimulator, it's important, but just to spread in the good way the product. But when I make filler, I love to make the massage because I can feel if the filler is in the good position, if it's symmetric, then I always make massage by myself, not by my assistant. You look amazing. Now we treat that neck. I will change my... Can I have another V20? Your neck is amazing. You don't have wrinkles or line. Disinfection is crazy important every time. Of course, it's so important, don't touch never the cannula, but I think that everyone do the same. And after we go to treat the area. I think that she doesn't need so much treatment in their neck because it's good without any line. When I will go to treat a neck with the line, normally I inject directly the line with the cannula. In this way, we inject a little bit her neck superficial. I'm so superficial. And then I don't have to push the cannula too much. I just have to find my straight. Okay, a little bit. Do you have pain? Just a little bit. Normally for the neck I make 3 points for every side. Do you feel pain? Little bit. She's laughing because she can't cry. And now we make our third point. Yeah, this is just the hyaluronic acid uncross-linked. Just to make hydration, to stimulate CD44 to produce new collagen. Okay. Then we make the same in the side, and sometimes if there are a lot of wrinkles, I make another point here, and I treat the anterior area too. Do you feel pain here? Hmm. We don't have to push. We just have to try to find the good street. And sometimes I inject a little bit of product to make space. It's painful? Here? You're not? Okay. Tell me if you have pain. I injected a little bit of product to make space. Okay. Done. Are you okay? Now we make soft massage on the neck too. It's important, don't make too hard massage in the neck because we can stimulate the sinoatrial, and after we can lose our pressure. a little bit. Now should be better. Don't take sun for a few days. Don't make hot shower, sauna, all the things that can make skin inflammation. Perfect, we are done. She is so pretty. Thank you.
Sorry, doctor, but regarding the injection, why you didn't go with the fan technique, or you chose the linear technique in the neck? So why don't you go to the fan technique? You inject line by line.
Yeah.
Okay. But my thought that do you recommend the fan technique? Inject in one point and then distribute it. What do you prefer?
I prefer make less point that I can, because every point should be possible that I will make a bruise. Then I try to make 3 points for each side, and then I will distribute my product with the line technique. But you can use that technique that is better for you, because it's not so important in this case. You are using a product without it's an uncross-linked hyaluronic acid. Then when you put the product and you make massage, you can spread the product when you want. Done.
Thank you. Brilliant demonstration. Thank you. I would like to know, I think that quite many of us here wants to know.
I can hear you.
Closer now. I think that many of us wanted to know how you use it in practice with your clients, how you combine the different products, when to do the fillers first, when to do the biostimulators, and how you add up with mesotherapy.
Normally, I prefer to restore the volume. Normally, I use the filler for the first time. And I make my shape, and after I treat the skin. Now we are starting to use a new protocol that in the same time we treat with the filler, the deep layer, and we treat in the same day the superficial area with the biostimulation. I don't like so much to make mesotherapy, because basically it's it's not so good for the patient because you have to make 100 injection in the face, and after it's possible to make a lot of bruises, and the patient doesn't want to go out for the clinic because it's full of it's full of bulges in their face. Then if you can use the cannula in a good way, superficial, in the deep derma or in the subcutaneous layer, you can treat with the cannula without problem. I think for me it's better.
But that's because you have resources with laser as well. When you started treating skin with laser, and we supply with maybe a little of meso afterwards.
We prefer to treat the skin before with the biostimulator and after with the technology. We prepare the skin to produce more collagen with the biostimulator. Then we use polylactic acid, we use this kind of biostimulator to prepare the skin, and after we make the energy. We make Morpheus, radio frequency, all the things that we have. After.
Sorry.
2-3 sessions. Normally it's 3 sessions. 3 sessions, 1 session a month, and after we can repeat 1 session after 3 months. This is normally we use the biostimulator.
And the duration?
Sorry?
The duration.
The duration, it's 1 year because you make 3 months, we stop for 3 months, we make another treatment, and after you can repeat after 6 months. And your skin still with the good hydration.
Thank you.
Thank you. Yeah, speak. That now we will go to the lunch, and after the lunch we will make 2 live injection. 1 full face with the filler and biostimulator, and 1 just with polylactic acid.
So the lunch is downstairs in the main restaurant. So we would like to invite you for the lunch, and after the lunch at 2 p.m. Yes.
Don't be shy. Don't be shy.
After the lunch, we will have, like the doctor said, live injections with 2 models.
Okay.
So let's go for the lunch. Thank you.
Thank you. Yeah, just want to drink a water. We are ready to start. Of course, I know that it's difficult after lunch. We'll have to. Can you hear me? No. We start with L. I need two syringes, three syringes of L, and three syringes.
Some problem with the mic.
Yes, three syringes of.
Medium.
Do you want to change the button?
Giovanni, you have a L over here, 3, and 2XL. Is that okay?
Yes, and I want another and one hem, two hem.
2M.
Could you say something?
I.
No.
Can you hear me?
Let me just take some room here.
Okay, let's try once again.
Hello? 1, 2, 3.
Oh,
Ah.
now it's working.
It's working. Perfect. Sorry, it's not my fault. It's after lunch is normal. Amazing. Now, can I have the gloves, please? Gloves.
Gloves.
Okay.
Extra large, right?
Yes. Yes, but I don't. Which kind of filler is this one?
This is large.
Then, okay, we are ready. We start with the full face technique, dual step, dual plane technique. We will make before treatment with the filler, deep, and after we will treat the skin with the biostimulator. In this case, we will use for the temporal area V20, and we use for all the face V5. Okay? Then we are ready. What I want to do in her face, I want to lift, can you open your eyes please? I want to lift a little bit her temporal area. I don't want to improve so much the lateral cheekbones because she already have a lot of lateral cheekbones, but I want to treat in her face the frontal cheekbones to sustain a little bit the eye. Then in her face we will go to treat the jawline. We don't have to treat the jowl here, not. I put X, not here. But we will go to treat the jawline from here. We will treat a little bit the preauricular area to make lifting, to lift a little bit her face. Then we treat her chin, and we treat the lateral area of the chin, the mental line here. If we want, we can treat a little bit her lips, and nothing more. And after the filler, we treat the area. This is with the V20, and we make a full face superficial with V5. We are ready to start. Okay, the first product that I will use is with the needle L from Infini line with the lidocaine. I love to use filler with the lidocaine because it's less painful for the patient, of course. Which is my point for the temporal filler. I touch the crest and I touch the orbital ring. Normally, I will go from the crest, one up, one down, 1 centimeter up, 1 centimeter down. But of course, even if we make aesthetic, we are doctor, then it's important to make inspection, to make palpation, because we have to know if her anatomy is the canonic anatomy or if there are something different. Then I will try to inject where I don't see any vessel.
You always use gunshot?
Sorry?
You always use the gunshot technique?
Yeah, normally I use before this kind of technique if I want to lift, because she loses a lot of volume. If I want to lift, I use technique with the needle deep, and after I use another technique with the soft filler superficial. Normally I inject 0.3, 0.4 deep, and I use 0.3, 0.4 superficial. Not more than this, because after that, if you inject so much filler, it should be possible that the patient have a headache after the treatment, like pressure. Okay. We start in our treatment. Light is not good. aspiration. I know that not everyone believes in the aspiration, but I prefer to make aspiration always. Then, tell me if you have pain, okay? And I inject so slowly. This is the, I think, the most important things. You have to inject slowly because you have to know what's happened, and after you can decide if you inject more or you can stop. Do you feel pain?
No.
Zero pain?
Zero.
Okay. Let me push a little bit. Show me. It's already enough for this side. We put a little bit more. And another point. Same things. Slow. Do you have pain?
No.
Okay. And I push a little bit. I use it 0.5 for this side. Yes, and it's so much better. Now we will make the same in this side. Then I lift the skin, I inject, aspiration before. Now tell me if you have pain.
No.
I'm on the periostea, on top of the bone, and I inject it so slowly. Now I injected 0.3. I stop a little bit, out. What do you feel? Pain?
No. It's okay.
I want to put a little bit more.
So this is like my favorite treatment to do. It's so easy. Once you know the anatomy,
Yes, it's amazing.
complications, you shouldn't be worried about treating these areas.
Basically, I treated my patient like 90% of my patient in this area because it's the first point to make lifting, to lift the face. You can have all your face in the best way, but if your eyes are closed, if your eyes are like watching down, is not good.
No.
Then this is always my first point. And I treated this area in the young people and not extra young people. Okay, I'll push a little bit. Then we speak about the hair cheekbones. Hair cheekbones in the lateral area are already big. If I inject so much the lateral area of the cheekbones, I make the temporal area like little. Then what I want to see, I will try to make the best proportion of the face to make a good harmonization. Then I will treat the cheekbones from the ligament just in the frontal area, just to sustain a little bit their eye. And to do that, I will use before the cannula, and if it's not enough, after I will use the needle, and I will go deep with the high G prime filler. Are you okay, my dear?
Yes.
So while you were at lunch break, we did an assessment, just so you know what type of clients we're working with here. She's 45 years old, if that's okay, I'm telling you that. She's never had anything done, so that's perfect for the treatment at the moment. And that's why we're also going to do a full face treatment. I'm going to explain you how we combine the things, fillers, V-line, and even talk a little bit about mesotherapy, because personally, I think Infini is the most intelligent product I've ever worked with, because it allows us to work in different layers, superficially, deep, profound, and then now V-line, the middle layer. And what we need to learn at this session, I would say, is that how we assess our clients for optimize the results, instead of just only treat them with fillers, but also to manage the skin as well.
Yes, the skin is the first point. If you have all the shape perfect, but your skin is not good, you are not good. Then we start with the cheekbones treatment. I make my entry point here a little bit. Then I don't have to stay superficial. I make this. I take the skin and I go deep. I'm on bone now. And this is my point. How do you feel? Do you feel pain?
A little bit.
Little bit, yes. It's a little bit painful. I know, not so much. I'm injecting a little bit in the frontal area to reproduce the soothe.
How many mil?
I will inject 0.5. Yes. 0.5 for each side. I think it's enough. And after we will see. If it's not enough, we will inject another 0.2, 0.3 deep.
You always use cannula at that area, or do you sometimes use bolus?
No, normally I use both. I use cannula and needle. Depend what I want to do. To treat the cheekbones, I love to use cannula because just with one movement you can reproduce the cheekbones. You don't have to make a few injections. Oops. Do you have pain?
No.
Amazing, amazing. Okay.
Renata is a lawyer in the military, so...
No. Now, I need XL, please. Oh, it's here, it's here, it's here. Now, I will use like IG Prime product to reproduce the joint line. Okay. Then, can you bite a little bit? Okay, strong, strong. We know that in front of the masseter we have the emergency of the facial artery. Then I don't want to make my point here because I don't want to make big bruises. I will make a little bit here, like far from the emergency of the facial artery. Okay. Then I go inside. I take my skin. The light is not the best here. I have a lot of shadow. I'm here. It's possible to see where I am. I'm literally on the corner. I take with my finger and I start to inject 0.2. And with the retrograde technique, I still inject it. I go now a little bit more high, and I inject a little bit more. Okay. And this is my new joint. Now, I will work on this side, please. Oh, okay, perfect.
So that's very interesting to see how you do it, because we have different techniques when we treat the jawline, but I actually like the way you're doing it, where I can see you leaving a small bolus at the angulus, and then he retreat. And while you retreat, you are injecting the fillers backwards.
Yes.
And in that way, you can stretch out the skin.
Okay, same things. I will arrive in the corner. I will make a little bit product. And after, this side is a little bit empty. Did you slip in this side?
Yes.
Okay. Yes, I want to inject a little bit more here because this side it's a little bit emptier. Then I need another XL.
Right there.
Great. Okay, now I just making symmetric. Okay, that's enough. With the same XL, I want to treat the chin in a deep area using the needle, and after I would use the cannula with the HEL product. I don't want to use XL in the frontal part. This is just to make a little bit of projection of her cheek. Okay, sorry. Now, tell me if you have pain. Okay, I go deep, I make aspiration, I take my point and I will inject 0.3. After, in the little bit more lateral, I will make the same because I don't like the chin just in the medium area. And then we'll improve it here a little bit. It's so important to go close to the bone and to make aspiration.
So when we work with fillers like this, we like to make sure we don't only work in the same area. Otherwise, it can look very overdone in the jaw lines. And when we're kind of stretching out the chin, you get a much more fine line, as we all want it, without looking overdone.
Yes, we inject a little bit more in the chin. But it's so much better now. I want to build a little bit more projection. Look at that. So much better now. Her joy line. Now, we just need a few syringes more, but not so much. Now I need, please, no XL, I need L.
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 Oh, she's bleeding.
It's not true, it's not real blood.
How do you find working with...
No. Don't worry.
Dr. Giovanni, how
Yes.
do you find working with Infini fillers?
It's good.
Yeah.
Yeah, they have good product.
Do you only use the Infini fillers, or do you work with other brands too?
This is his secret.
Okay. Well, I don't have secrets. I only use Infini. I like to
Now
work with Infini.
now I'm using a lot of Infini filler, just like filler and for the biostimulation. And I used the polylactic acid, and it's very, very, very good. Bloody chin.
I would say if you're not an experienced injector, working with the same brand is a very good idea to reduce complications, difficulties, knowing what kind of products you're using, whether it is V-line, biostimulators, fillers, or mesotherapy. Because, as I said, it's a very, very intelligent brand. You know what the ingredients are, and it's also a CE-approved product. If any one of you should be worried about that part, it is an approved product. And honestly, I've worked with a lot of products during my time as a aesthetic doctor, and I have to say this is one of the best products I've ever used. And I like to make things as simple as possible.
Yes. The best things to reduce the problem, for me, first point is anatomy, second point is a technique, and third point is the product. If you use the wrong product, or if you use the right product but in the wrong place, you can have a lot of problem. Then it's really important to use a good product. This is what I tell all the time to my patients. Then we will work a little bit for the marionette line. We want to improve, not so much here because I think that she already did something here. Yes, I feel it. But we want to make a little bit, just a few points to stretch the skin. I make here my entry point. This area is a little bit painful, sorry. But I will try to make my best to be gentle. Okay. Okay. I'm here. And I will inject a little bit with the retrograde technique. Can you open your mouth, please? Okay. Okay.
Do you normally do large treatments on your patients?
Sorry?
Do you normally do large
Large?
treatments?
Full face?
Yeah.
Yes, normally yes. Because for me it's not, it's which is the sense of beautiness. The sense of beautiness for me is the harmony. Then if you have the best lips all over the world or the best nose all over the world, but your face is not in the same level, you are not in the same level. It's like if you have the best suit, but your shoes are older with the hole. You have to treat all the face. This is so important to my sense of beautiness.
But not all clients can afford the big sessions. So what we're going to show you today, when we start at one point from the top, is because we sometimes have to divide the sessions into 2 or 3.
Yes, of course.
Yeah. So always start on top and then work downwards.
Yes. Yes, this is my philosophy too. I always start on top and after I go down. But I try always to finish the part that I start. Like if I need 2 syringes and the client told me I can spend just 2 syringes, I prefer to use 2 syringes on top, and after I will use another 5, 6 or how many syringes I need.
What do you think about treating the forehead?
Yes, it's good. It's good with the filler. It's good with the filler because in the forehead we lose volume like in every place, and normally I treat it a lot, more in the woman than in a man. I use the same point for the temporal filler.
Okay.
And I use a technique. I go down with the cannula. I make aspiration. I inject 0.1, and when you inject 0.1, the skin make like this. You have a space. Then I go slowly, slowly, slowly inside. I make aspiration. You have to know that you are on bone, because if you inject in the middle of the muscle, it's painful, and after they have headache. Then it's so important that you inject slow and you speak with the patient. Do you have pain? Do you have pain? And if it's not, you can still inject in. Okay.
Do you ever treat nasolabial line?
Sorry?
Do you ever treat nasolabial line? The nasolabial line, the piriformis?
After.
Yeah.
Before I make my lifting, and if the nasolabial line still, I inject deep a little bit just on the roots, just in the piriform fossa, and sometimes I inject a few products superficial, but really few products superficial, and I never go in the middle. I just treat the upper area, because if you go to the middle, you make like a donkey face, because you improve the volume here, and it's really not good, not classy. 0. Do you have pain now?
Yes, but only a little bit.
Yeah, amazing.
So-
yeah, this area is painful. But she is a soldier and... Okay, then we have to treat the preauricular area. I will use the M to stretch a little bit more. Yeah, so beautiful. Here you will have, I think that you will have a bruises. Okay. Then This is my entry point. Like before, I look the skin, because if there are vessels, I try to don't take the vessel. I go inside. I take my skin because I want to go a little bit deep. And I will arrive till the trago. And I start to inject a little bit of product, more in the upper area. Normally I inject 0.5 for each side, not more. Okay. And after, I will push it. Okay.
So that's another very great treatment, because we actually take advantage of the ligament to stretch it out.
This is the first point. We have to stretch the ligament. Because we lose volume, we lose the position of our ligament. Then if you want to lift, we have to work to the ligament. Now we go up here. Okay, do you have pain here?
A little bit.
Same things. We will inject 0.5 just in the upper area. And we push a little bit. Okay. Now, in her face should be possible to treat the piriform area with the deep injection. But today we can use the biostimulator. Then we start directly with the biostimulator. I need V20. Can I have new cannula, 25 gauge, please? One V20, and I need one V5. Can I have the new cannula? Yes. No, 25 gauge. Okay, yes, this one. Then, what we want to do with the V20, that is just hyaluronic acid, uncross-linked hyaluronic acid, I will treat the temporal area in the superficial way. With the V5, I will make full face treatment to improve her skin quality and her skin laxity. Then normally my point is from here, close to the zygomatic bone, superficial. This is my entry point. I go superficial. I don't have to push. It's so important. If I push, I will make bruises. I just try to find my street. Okay. Okay, aspiration. And I try to inject a little bit. No, I will make a little bit of massage. It's not cross-linked at the hyaluronic acid, then don't make deposit.
And that's why it's a perfect combination, because it's not cross-linked.
Yes.
So we started with
a cross-linked.
large.
We started treating the deep layer. Now we are treating basically just the skin. We are improving her skin quality, treating in the superficial area, in the deep derma or immediately subcutaneous place. Then same things.
So how many mil in total?
I will put 0.5 for each side. We don't need so much. This is not to improve the volume, is to sustain, to produce collagen. Okay. Now we will use the V5, which is the hyaluronic acid, two different type of hyaluronic acid plus trialose. Where is the? Okay. And we have to stay superficial. I will make one entry point here on top of the cheekbones, superficial. And after, I will inject my product superficial. Superficial, look at that. I can make another point from the joiner. On superficial. Now, which way I can treat my nasolabial fold? I put my point in the middle, and then I will stay superficial here too, of course. Aspiration, and I will inject a little bit. Okay. We will do the same in the another side. Can I have another L, please? L. same treatment in a different site. Superficial. Do you have pain?
No.
Too gentle, okay.
Do you always combine your V5 with your filler treatments?
My V5 with the with the V20?
Yeah.
Yes. If I want to make a biostimulation in all the face, yes, it's better to combine in this case. Do you have pain here? No? Now I need L with the needle. L, okay.
So let me talk you through the treatments. Just to sum up what we've been doing. How are you feeling? Yeah. So we always start at the top from the temple and work downwards and start profoundly to lift up, because you get that objectively results that most of our clients are measuring the treatments. And afterwards, you supply it with the biostimulator. But if you do the biostimulations alone, isolated, without the fillers, definitely the clients are going to be a little bit disappointed, because they still are expecting some kind of volume changes of their results.
Can I make your lips?
Yes.
Just a 2-point. Just really, really 2-point. I don't want to improve so much the lips. Okay. Open a little bit your mouth, please. Just 2 points. Sorry, I know. Just to make a little bit shape. I don't want to improve so much the volume, just for the shape, because her lips was a little bit flat. Open your mouth, please. Relax you, please. We are finishing. 1, 2. Okay, I will inject 2 points in the lower lips. Open a little bit your mouth, please. Are you okay?
Yes.
Can you open your mouth, please? Open more. More. I will treat from the MODO. I will inject a little bit to sustain and this. Close your mouth. Better. She have a lot of skin here, then it's not enough. But this is our first step. Open, please, a little bit. Okay. Done. We finish it. I don't want to inject so much in her. Of course, this is the first step. If we want to make more, we can make more. She have to make, after that, she have to make Botox. That should be so important in her face to reduce the wrinkles and to open a little bit her eyes. And after, we can make, after 1 month, we will see all the results and we can make a little bit of retouching the cheekbones to open a little bit. Yes. But I think that for today, the results, it's more than enough. I will clean your face. Do you have before? Do you have before? Okay. Okay. Can you open me the cream? Yes. She's so rich. Too keen.
Too much?
Okay. We make soft massage. I told you before that for me it's I don't want to take your hair. It's really important to make the massage because I know where is the product and I know if there are asymmetry in the position of the product. Okay, perfect. Down. Thank you. Look in the camera. Wow, such a beautiful lady. much better. Next time we can add a little bit more here if we want in the second treatment. Not today because she started to be a little bit swollen now after the treatment. Okay? Thank you for now.
So 6.5 mil in total, and
How many ml we use?
6.5,
7.
nearly.
We will use the VU20, which is the polylactic acid, and VU5 just for VU5, yes, just for the temporal area. Yeah. No, sorry, V10 and V20 we use. We use V10 for all the face, and V20 just for the temporal area. Okay. We are ready. There we clean everything. I did a mess. Okay, just Botox. Okay, perfect. Okay, this is our second model. Can I have something for her hair? Can you use this for your hair, please? Then we will treat a temporal area with the V20, just no cross-linked hyaluronic acid, and we make deep biostimulation with a little bit of volume with the V10, which is the polylactic acid. We prepared this morning the polylactic acid. This acid doesn't need 24 or hour or 2 days. We can prepare 2-3 hours before the treatment. Then we start. Are you ready? Okay. Okay, we are ready to go. Then we start with the no cross-linked hyaluronic acid to treat the temporal area. Our point is over on the cheekbones. And after, we go inside with the cannula. We have to stay superficial. I don't have to push. If I have my street, I don't have to push. And then I start to inject a little bit of product. I don't need too much product. My goal is not to make volume, it's just to stimulate the collagen. Okay. Are you okay?
Yes.
I will make the same in this side. Just a superficial point. I go superficial with my cannula. I find it my point, then it's easier to inject.
Giovanni, the audience asking you what kind of products do you use? They didn't hear. Once again, if you can tell what kind of products you use.
Now we are using just no cross-linked hyaluronic acid, which is V20. Okay. Now we make our massage. After that, we will make full face with polylactic acid, V10. Can I have, okay. We prepared V10 this morning, few hours ago. And now we will use it.
And it's without lidocaine.
Yes, it's without lidocaine today. Okay. We take a new cannula. We don't need to make 1,000 point to spread the polylactic acid. Normally make 2, 3 point. 3 point, it's enough for her face, and with this cannula. We start a little bit down of the cheekbones. Of course, we watch the skin. We try to don't inject inside of the vessel, or don't take vessel with our trocar. We cover the hair, and we go.
So let me just go through the V10
Superficial.
product. It's a polylactic acid that is diluted in total 10 ml. Today without lidocaine, but normally you will dilute it with 8 ml of sterile water and 2 ml of lidocaine.
Is it painful? A little bit. What do you feel?
It's not nice.
Little bit bruised.
But yeah.
A little bit burn. Okay, a little bit. This cannula is really big. Do you feel pain from here? I need to go a little bit more inside. Okay, until the nasolabial full. I put the mid product. Yes, do you feel a little bit? Are you okay? Yes, this is the worst area ever. But do you know which is best? Done for this. We use it just to point because this cannula is really big.
Dr. Giovanni, would you use that around the temple?
Sorry?
Would you use V10 at the temple? Would you inject into the temple?
And we use it V20, just the hyaluronic acid.
But you will never use V10?
To inject the temple polylactic acid, no, I don't like it.
Why not?
I don't like it because the temporal area is real dangerous area. Then I prefer to inject always just with the filler, because if there is some problem, I can dissolve fast the filler with the hyaluronic acid. This is the, I think that is the best to be always safe.
Yeah. And other areas is around your lips as well to avoid.
Yes, around the lips, under the eye. I don't like to use polylactic acid in this area. There are people that use it, but the first point of medicine for me is don't be something worse. In Latino is primum non nocere. You don't have to make nothing worse for your patient for the first time, and after you have to make good results.
And there's no point now that we have a V20 to treat the temple.
Sorry, my dear, this cannula it's a little bit bigger. Yes, for beauty, everything is loud.
I promise you get the most beautiful skin once it's done.
It's not that bad, but it's not nice.
Okay. We make just another point here and we finish. What do you feel now? Do you feel burn?
Little, but it's fine.
So with V10 product, you don't have to prep
We finish it.
like 6 hours before, as we do with the Sculptra. Sculptra at least 6 hours before, usually the day before you go to work the next day. And if the client's not showing up, what to do then? Here you can prep it quite immediately.
Now, what she have to do? She have to make a strong massage, like this, to spread in the good way all the product. She have to stay like few minutes, 2-3 minutes, for 5 times a day for 5 days to make face massage. This is the most important things when you use polylactic acid. Always, after the treatment, you have to know that you have to make massage in your face. Okay?
In a specific way?
Like this, like this, like this, like this.
So to
You have to,
side.
yes, to the side, and you have to push a little bit. Don't make too gentle massage because doesn't work. Okay?
How many times?
5 minutes, 5 times a day, 5 days. Okay? Any pain now?
No.
No. Perfect. We're done. Great.
Now it's just about being patient and to make it work.
Can you hear me now? Okay. Then we finish with the treatment. Any question about it?
Lots of questions.
Everything was easy to understand, yes, of course. Okay, then we will send off the diploma about this little training course. And after nothing, we are really happy for that. And really thank you so much for everything. Yeah. I need someone to help me for the name. She left. Okay, Gina Viliande. Yeah. Ah, she's coming. Okay. Thank you. Thank you. Thank you so much. Do you want to make a picture?